Hello guys, I hope you're well. And today we're discussing why should you be cautious with hypokalemia in the exam. So hypokalemia is sort of reduced potassium levels. Also, what is the reference range for potassium? So potassium regularly is a reference range of 3.5 to 5.3. So that is the normal reference range. So anything under 3.5 would be essentially hypokalemia, or sometimes it could be under 3. It depends on the source. Sometimes in exams they refer to it as 3.3 to 5.3 or 3.3 to 5.5. So it depends really on the author, right? So that's the first point. Now, another additional point that we need to know is what can hypokalemia lead to? So hypokalemia can lead to QT interval prolongation and cardiac arrhythmias. So that's two big problems that you can get when you have hypokalemia, right? And you need to be aware of that. So QT interval prolongation and cardiac arrhythmias are two things that you need to be aware of. Now, why is that important? Because for a lot of drugs that have cardiac arrhythmias as a caution, for instance, some drugs you cannot give in arrhythmias, some drugs you cannot give in, because they already cause hypokalemia, so you should not give other hypokalemia causing drugs, right? And for elderly patients, for example, hypokalemia is not going to help them in any way. It's going to make it worse, right? So for example, when you have a calcium channel blocker such as verapamil, which is a rate control or rate limiting calcium channel blocker, one caution is elderly, right? So this is one example of a caution, and that's because in elderly, verapamil may worsen heart failure and is potentially inappropriate of patients who have heart failure with reduced ejection fraction. So verapamil is contraindicated in elderly, those that have, so patients that are elderly and have heart failure with reduced ejection fraction. So verapamil is contraindicated in HF with reduced EF for elderly. Now, if we quickly just look at beta blockers. So beta blockers, some of them can be used as rhythm control in arrhythmias, because you need to bear in mind that when you have an arrhythmia, you have two forms of treatment. You have rate control and you have rhythm control. So sotalol is an example of a beta blocker that can cause QT interval prolongation, and for that fact, this is why it's used as rhythm control. And sotalol is one of the only antibiotics that has major rhythm control activity, and that's why it also increases QT interval prolongation. So if we quickly go to some other points, just wanted to quickly go over spironolactone. So spironolactone can cause gynecomastia, which is an important point. And when we think of spironolactone, we should know when it's used. So when is spironolactone used? Spironolactone can be used in confirmed HF or reduced EF. So confirmed heart failure with reduced ejection fraction.